Do you frequently feel like your chest is heavy and you're having trouble breathing, especially after traveling somewhere hot and dry? Or maybe someone you know suddenly got very sick with a cough and high fever that just wouldn't go away. That could be more than just a bad cold. It might be something called Middle East Respiratory Syndrome, or MERS. It's a serious lung disease that first showed up around 2012 in Saudi Arabia. Many people didn't know much about it at first, but now we know it spreads from animals to people, and sometimes from person to person. Think of it like a hidden virus that sneaks in and attacks your lungs, making it hard to breathe. It's rare, but when it happens, it needs quick attention. Great question. MERS is caused by a virus called MERS-CoV, which is part of the coronavirus family. Yes, the same big family that includes the virus that causes COVID-19, but this one is different. Imagine a tiny virus riding on a camel's breath. Sounds strange, but it's true. Most people got MERS after close contact with dromedary camels. Those are the camels with one hump. These animals can carry the virus without getting very sick. If you touch a sick camel or drink its raw milk, the virus can jump to you. Then, if you cough or sneeze without covering your mouth, you might pass it to others. So the virus doesn't just appear. It has a journey from camels to humans, and sometimes between humans. How do you know if you or someone you care about has MERS? Let's play a quick game. Imagine you've been to a camel farm or a Middle Eastern country recently. Now you feel feverish, have a bad cough, and it's getting harder to catch your breath. Does that sound like just a cold? Not really. These are classic signs of MERS. Some people also feel very tired, have muscle pain, or even diarrhea. Older adults or people with diabetes or weak immune systems tend to get hit the hardest. Think of your body like a castle under attack. The virus storms in, and your defenses go into overdrive, making you feel terrible. But not everyone shows the same signs. Some people only have mild symptoms, like a sore throat. But since it can get serious fast, it's always better to check with a doctor. Now, how do doctors find out it's MERS, and not just a bad flu? They don't guess, they test. Usually, they take swabs from your nose or throat, or they collect a bit of mucus from your lungs. It's quick, not very painful, and helps catch the virus red-handed. Sometimes, they might also test your blood. But here's the real talk. Unlike flu or bacterial infections, there's no specific medicine that kills the MERS virus yet. So treatment is mostly about helping your body fight it. If you're really sick, doctors give oxygen, fluids, and help you breathe, kind of like giving your lungs a rest while your body does the work. No superhero pill yet, but good care makes a big difference. The earlier the diagnosis, the better the chance to recover. Can we stop MERS before it starts? Absolutely. Think of prevention like wearing a seatbelt. Just because accidents are rare doesn't mean we skip safety. First, if you're near camels, avoid their spit, milk, or close contact, especially if they look sick. Wash your hands often with soap, like after touching animals or before eating. It sounds basic, but it works. Also, if someone around you is coughing and has traveled recently, gently encourage them to wear a mask and see a doctor. In hospitals, staff use gloves, masks, and gowns to stay safe, because stopping the spread starts with small habits. Simple actions today can save lives tomorrow. What's new in the world of MERS? Scientists aren't giving up. Even though MERS isn't spreading wildly right now, researchers are working hard, just like detectives solving a mystery. They're testing vaccines in animals that could one day protect people, especially those working with camels. Others are studying how the virus changes and spreads, so we can catch outbreaks early. In labs, new rapid tests are being made to find the virus in minutes, not days. It's like upgrading from a flip phone to a smartphone for disease detection. These steps might not help today, but they're building a safer future where MERS could one day